Functional neurological disorder, short for FND, is on the rise. According to the National Institute of Health, anywhere between 4 to 12 per 100,000 people do get diagnosed with FND. For teenagers specifically, about 1/3 of the patients who see neurology for their conditions do get diagnosed with FND. And in fact, FND is the second most common diagnosis teens do get from a neurologist. In this channel, I offer practical tips and tools for highly intelligent and compassionate teens and their parents on how to overcome chronic pain so that they can reclaim their life and feel confident about their ability to overcome any obstacles in their lives. By the way, if you are a caring parent who wants to know exactly what to do to help your child overcome chronic pain or FND, click the link below to grab a free PDF parenting guide today. Now, April is the FND Awareness Month, and many teens who struggle with chronic pain also struggle with FND. So I'm going to talk about what the heck FND is today in this video. So FND is an umbrella term to describe this cross-wired problem between your brain and then your body. Put it another way, you may experience seizures, weakness in your body, paralysis, pain, or sensory changes such as vision loss when physically you're quote-unquote fine. FND has many different subcategories. The most common one is called functional seizures, also known as PNES or NES for short. The second common one is anything to do with the movement. So it could be the weakness, paralysis, numbness and tinglings and jerks and twitches and tics and things like that. The next common category of the functional somatic symptoms within the functional neurological disorder can also include chronic pain, such as headaches, migraines, muscle pain, fibromyalgia, complex regional pain syndrome, short for CRPS. And then there's also the sensory issues, as I mentioned, such as vision loss. Now, common myth about FND, I hear this all the time. Some conventional doctors still say, this makes me really angry, but they would say it's all psychological. No, it's a lot more complex than that, which I'm going to get into it. Or the common myth is doctors don't know what they're doing. Well, FND treatment is primarily done with psychologists who specialize in this area, but mostly several providers are also involved, such as physical therapy, occupational therapy, and medical doctors. And this is such a highly specialized area, so not all doctors do know exactly what to do to treat FND. So it is partially true. But does that mean that no one can help? That's not really true either. The common myth I also hear is FND will go away on its own. Well, yes and no. It may go away spontaneously, but studies shows about 2/3 of these people who have FND symptoms come back again if they don't do anything. So what can you do actually to overcome FND? Well, there are 3 major categories. Number 1, see a neurologist and make sure you don't have anything else because comorbidities are common for people who have FND. For example, you might have epilepsy and FND at the same time, right? But you just want to make sure that you're not missing anything other than FND, okay? So number 2, you really need to know what FND is because it's a complex phenomenon and it is no longer just a biological phenomenon. And in fact, it is actually a biopsychosocial phenomenon. So biopsychosocial phenomenon has 3 prongs to it. One is biological, as the name indicates, and then psychological, and then social components. Biological components include anything like injury, illness, genetics, family history, lifestyle, sleep, eating, and things like that. And the psychological component includes anything like psychiatric history, but more importantly, your ability to cope with difficult situations, mindset, the way you think, the way you feel, the way you act, self-esteem. Those are all part of the psychological factors. And social factors can be social skills, family, school, extracurricular activities, cultural expectations, what's happening in the surrounding environment. Okay, so all of these things need to be taken into consideration because FND is such a complex thing. Once again, FND is no longer just a pure biological or missed diagnosis. And related to that, refusing to believe a complex phenomenon of FND, as I mentioned, aka you're only believing this is a pure biological or missed diagnosis, will only delay the recovery. Number 3, you have to work with a specialist because you don't have to do this alone. Studies show the sooner you start working with an FND specialist, the better the outcome is. So why wait? FND is real and your kids are not faking. FND can be debilitating, but it is definitely a solvable problem. Now, if you are a dedicated parent who is so sick of trying numerous ineffective procedures and medications for your child and ready to empower you and your child to take the first step towards solving FND, then click the link below to schedule a call with me directly and see if you qualify for my program. Thank you again for watching this video to help your child overcome FND, and I will see you in the next video.